Hi, my name's Kathy, and I just finished my first year at University of Toronto Faculty of Dentistry.
Hello, my name is Jack Hahn. I go to University of California, San Francisco, and I am currently a D2.
Hello, my name is Varun Patel, and I'm a second-year student at Ross University School of Medicine.
Hi, my name is Sarah. I'm a third-year medical student at Jefferson in Philadelphia.
Hello, my name is Eleni, and I attend Tufts University, and I am a second year.
When talking about dental medical divide, we used to think dental school and medical schools are very different. For example, in school, dental school gets very hands-on from the very beginning, like we started drilling since first semester. Then med school, the first few years are quite didactic-based. And after school, the work environment is also different. I think most physicians work in public settings, but most dentists work in private practices.
So when I think of the dental medical divide, I typically think about how medicine is considered, you're a doctor, and when people think of a dentist, they think, oh, you are not a doctor, you're not as high of a standard as a medical doctor. And I think that people perceive medicine as a higher priority versus dentistry. People don't take dentistry as seriously as, if you're a medical doctor.
I think that there's some specifics to both sides of the story, because if you consider dentistry as a craft more so, because dentists have more of an integrated approach to it, and they're more meticulous about how they do their craft versus how doctors operate. So that's why there's a difference. But in contrast, there's a lot of similarities as well between the two. They learn the same things. Any things related to teeth are always related to the body, so everything's connected.
What comes to mind when I think about the medical dental school divide is really just from my experience in the time I've spent in medical school thus far. Really, dental health and dental school is not talked about a ton, and I think integration would make sense.
I know that UCSF has done interprofessional work where we combine all the different schools, so medicine, dentistry, but also nursing, pharmacy, physical therapy into one class. In that class, we learn about what we do have in common. So just the ethics side and how to treat our patients. I know that some dental schools such as Harvard has integrated more so the dentistry and medicine aspect, with the dental students actually going to medical school for the first year.
To some extent, I think integrating dental school and medical school is a good idea, because now we understand more about the connection between oral and overall health. For example, periodontal diseases are connected to diabetes and cardiovascular diseases. And now more and more dentists realize that we're not only treating patients' teeth, but we're treating patients as a whole. However, I think it's almost unrealistic to learn all medical and dental knowledge in 4 years, because there's just so much to it.
I think the dental schools and medical schools can be more integrated. We could take more classes together, such as the basic biomedical sciences. And more schools could have the dental students join in with the medical students on those specific classes. Of course, it makes sense that there is some separation. I don't see any medical students going into simulation lab and practicing on typodonts. I know that UCSF is actually moving off of Axiom to a new software called Epic. And Epic allows better integration between the medicine and the dentistry side of a patient's history.
I don't have a ton of experience in how it impacts patient care, but what I've heard from doctors is that it definitely can impact patient care, especially for procedures or something like radiation that has to occur to the head or neck. Really good mouth hygiene is very necessary, and problems can often come up even because there's a divide in health insurance in terms of coverage for dental care not being there when there is coverage for other types of medical care, and that can become problematic. So I definitely think some level of integration, if it like starts at the school level, would make sense, just to kind of encourage understanding between the fields, because I'm sure there is like way more overlap than I realize and that many people realize. And I do think there's probably many schools that are taking those steps.
Overall, I think that integration is a good idea, so I'm more for it, because I think if we can integrate the two and we all could work together, it would be more efficient, I think.
I know that some schools do have it already integrated. I know that UConn has their medical and dental students in the same classes for the first 2 years. And I do know that at Tufts, we do have a lot of similar classes as the medical students. However, I do enjoy learning dental specific facts and diseases when we are studying biochemistry and microbiology. I do really enjoy learning dental specific things. So I think that in that regards, I don't think that medical and dental schools should be integrated. I know that we do have very similar things. I really like how Tufts does it. We're separate, but we have similar professors, and then the professors will, make it towards dentistry when they teach us versus the medical students. So I really do like that.
I think as a first step to integrate those two schools, we can have some sort of classes like Interprofessional Education, in which we bring all healthcare professional students together to have a class. We may include med, dent, PTOT, nursing, and social work. In this way, we can understand the roles of different healthcare professionals and how we can work together to better help our patients.
Even if we don't take the same classes together, there's definitely more interprofessional work that could be done together. I see the biggest focus of that being on patients and like how we're talking to patients, treating patients, building rapport, and that relationship. The better that we can integrate all of the healthcare fields means that the patients will get better, more efficient care, and we'll be able to treat more patients more effectively.
I know my school is making some efforts to kind of have some interprofessional kind of groups or activities to try to promote kind of understanding between different fields within healthcare. And so I think kind of doing that at a broader level, I'm sure it would be a good idea.
Learning how to better integrate medicine and dentistry starts with an understanding of how they are discussed in dental and medical schools. If there is not meaningful discussion or conversation about how these professions are connected, of course, there are going to be challenges with regards to integrating. Many of the students in the video agreed that although specific dental terminology should only be taught in dental schools, there should be much more understanding between the fields, whether that be having medical and dental students take more classes together or having more interprofessional education and activities. Treating patients is not limited to just treating the mouth or treating everything but the mouth. And that is why transforming medical and dental education is incredibly important and could be life-changing to patients.